I do see a lot of ADHD, and I see a lot of people diagnosed with bipolar disorder. And, that one can be tricky because if you're under same with ADHD, some of these diagnoses are very difficult unless there's like a pattern prior to use. Because, those also look a lot like substance use too. I know that a lot of times those diagnoses, they are not given until, somebody's been sober for, extended period of time to kind of differentiate the two. But
welcome back to the You Need a Counselor podcast. This is a show presented by Heart and Solutions Counseling Agency. We release new episodes every Sunday at 5 p.m. Central and encourage you to batch up that laundry, put away the dishes, plan for the week ahead, or do any other task that might seem daunting while you give our show a listen. You might just be encouraged to call your therapist, connect with this week's guest, or seek out those services you've been considering for a while but haven't made the commitment to yet. If you are in the state of Iowa and are in need of mental or behavioral health counseling, give us a call at 1-800-531-4236. Enjoy the show.
Hello, and welcome back to the You Need a Counselor podcast. My name is Dr. Julie Johnson. I'm the president and founder here at Heart and Solutions, mental health counseling and behavioral health counseling here in Iowa. And this is the You Need a Counselor podcast. The mission of this podcast is to share stories about counseling with people who are curious about counseling, but maybe people who have barriers that maybe keep them from experiencing the benefits of counseling. So our mission is to share stories about counseling, good, bad, and indifferent, and spread the message that everyone can benefit from mental health and behavioral health counseling services. And our guest today is a return guest. So we've had Ashley here on the podcast before talking about what it's like to be an alcohol and drug counselor. So we've got Ashley Casey here today. Ashley is a mother of 4. She is a licensed alcohol and drug counselor and currently a graduate student studying counseling. And we got to hear some about, your journey to becoming a counselor in the previous episode. So welcome, Ashley. Thanks for coming back.
Thanks for having me. Excited.
So last time we got to talk a little bit about your graduate school progress and journey. Can you give us an update on where are you at now and what can you share about what that's like?
Yeah, so currently I am I'm at the halfway point now. So I will be starting my practicum this summer, or actually, sorry, take that back. I will start my practicum in January and then internship for the 2 following semesters. And then I am back to work in the counseling field. So, because I had taken a short break. But I'm back, and that's been a very nice transition. And then, yeah, as far as school goes, I'm ready to have a Christmas break.
So, I think sometimes when people think about counselors, there's a little bit of mystery, right? About like what goes into becoming a counselor, right? Like what is that schooling like? When people say an internship or a practicum, like what does that mean? So you're right in the thick of it. So
Yeah.
what is it like to be in graduate school? What kinds of things are you studying? Because I think sometimes people think, well, counseling, you're learning how to listen, right, to analyze, but there are a lot of other factors that go in. There's a lot of different classes that when I was in graduate school, I thought, oh my gosh, I didn't know I was signing up to learn about these things, but this is great. What are some of those things for you?
Well, for me, because I have my undergrad in counseling as well, just specialized the addictions counseling. So a lot of my master's classes are a lot of crossover with that. I feel like a lot of it is kind of the same, like my group counseling class, for instance. I just got done with that I will be getting done with that this week. For group counseling, I mean, I've been doing that for 10 years. So it's kind of like, just like a refresher course, I guess. But there are some new things, like some of the different theories that we didn't talk about in undergrad, the research class, the diagnostic and pharmacology is different than in my undergrad. So, I mean, there's a lot of really good things. And I kind of went into research thinking I really enjoy research, and then I quickly realized that it's really not my strong suit. Um, so I'll just stick to counseling. Um, but yeah, it's been interesting for sure. Definitely nothing wasted. All of it is kind of building on to what I already know. So that's good stuff.
Yeah, I mean the counseling field, right? It's an art. When you get a master's, you get a master's of arts. And so when we think about an art, sometimes we'll think about like pottery, or painting or something like that. And it really is because there's a lot of science that goes into the practice of counseling. There's a lot of brain science and development and research that goes into it. But at the end of the day, the experience that you're talking about, that okay, I've run this many groups, I've
Yeah.
experienced these things happening to me, I know what it feels like to sit with somebody who's going through this, or I know what it feels like to see this kind of group dynamic happen in a group as a facilitator. And each of those iterations, every time we do it, we get more and more practiced because it really is an art. It's a science-based art.
Yeah, I feel like knowing more theories. I mean, we went over theories in my undergrad, but these ones are more in depth. And I've the more I know about them, the more I'm able to go, okay, like a client who's asking about parenting. They're having parenting struggles, and I can kind of go back to more of like that lifespan development, some of those theories there, and have more insight into that to offer psychoeducation and things like that. So, yeah, it is very um, it's good stuff. And I think too, like I actually just started doing counseling myself again. It's been a few years since I've done that, and I decided to get back into that myself as a client. So, um, and I chose to go with someone who's at a doctorate level for obvious reasons. But even just the insight that my counselor gives me is even like, oh yeah, I guess I didn't really think of that, because it's for me being in counseling, it's more like a psychoeducational, like just a lot of information more than processing, which is super helpful because that's how I understand it better for me. And so like just different things that I hadn't thought of, different theorists and different um, ideology. So yeah, it really is an art, and there's so many, it's so complex. There's just so many different, what do I want to say, like aspects to mental health. When we're looking at anxiety and where does that come from, or when we're looking at depression and where does that stem from, and inner child stuff, and there's just so many different complexities to it that it is an art form for sure.
Yeah, it really is. And so I love it when counselors go to counseling. It is so important. And so many graduate programs require that counselors, while we're in grad school, that we go do our own counseling. I think that's so important. So
Mhm.
for somebody who may be listening and going like, oh, it's been a while. It's been a while since I've, tried counseling or gone to counseling or thought about counseling. What were some things that kind of helped you go, okay, it has been a while. I'm gonna go ahead and start this again.
Well, we actually had a lot of recent life changes. And so, kind of updating the bio, I have 4 kids biologically, but now I have 5. Um, we recently got custody, guardianship of my husband's cousin after her mom passed away back in April. Um, so she's integrated into our home, and so there's just, and then going back to working in the counseling field again after a short break, and just a lot of things. And so I just thought, this would be a good time to just, I feel like if you're waiting until you are in like a crisis mode, or like things are not well, I feel like it's important for me to be engaging in that before that happens, to maybe prevent some of that from happening. And not that things would go into crisis, but just life has its ebbs and flows, and like I would rather be in proactive than reactive.
Absolutely. it's kind of like, if we know that if we're out hiking and a rock falls on us, right, and we have to catch this heavy thing, it's much more difficult to do that if we haven't done weight training in the years and months ahead of time. So we never know when a rock is going to fall on us. And so if we have that strength built up, if we are doing those things before the rock is falling on us, then we have more strength, right, to be able to use when that happens. And the process of getting into counseling and the process of building that rapport and feeling comfortable and going like, yeah, this is a person that I could talk to when a rock is falling on me. That takes time. And
Yeah.
when the rock is falling on us, we don't have time a lot of times to do that. So I love
Yeah.
that approach of no, I want to do that beforehand. I want to do it before things start to fall on me because then I can be prepared and have that net already built under
Mhm.
me. What a great start. Yeah, what a great idea. And additions to family, oh my goodness, what a change.
It
That,
is. It really is.
uh-huh, absolutely.
And I talked in the last time we did this, we talked a little bit about my daughter and how she struggled when she was younger, and she's done much better. Obviously there's always room for growth. And so I just wanted to also kind of be prepared too for like any setbacks that could happen with big life changes. Um, and this is one of them. It's a big life change, and it's not a bad thing. It's a good thing, but it does, it does impact people in ways that we don't always expect it to. So, yeah.
Yeah, absolutely.
Right.
And I think sometimes there's this idea that counseling, like we go to counseling when something's wrong, but sometimes those big life changes, they can be great things, right? We could be adding a member to our family in whatever way that happens. That's a wonderful thing for so many reasons. And also any change is going to be hard. Change is hard, even good change. And so we'll even things that people think are like, oh, this is great. Why would you ever need counseling for a promotion, right? Moving houses, anything like that is going to be change. And as humans, we like routine. We like the
Yeah.
comfort of our routines. And a lot of times our coping strategies are so built into those routines that we go, oh, okay, that the way that I've found to either regulate myself, right, in those situations, I'm not thinking about those things anymore, right? My morning walk is automatic, or my morning 5 minutes with my cup of coffee in the morning, that's automatic, and I'm not thinking about those things, and I'm not doing them intentionally anymore. It's just like tying shoes now.
Right.
But then as soon as that gets out of whack, right? As soon as it's like, nope, 3 days this week, something has happened in the morning and all of that stuff has passed. And I go, how can something so small, such a small change in our routine, create such a big change in ourselves, right? We don't think about it when we're going through it. And then sometimes it's tempting to blame the situation, right, for our deregulation, as opposed to like, no, that situation is very challenging. And also I'm deregulated because all of my coping strategies are not,
Yeah.
not able to do them right now.
Yeah. Yeah. And I actually, my first session going back to counseling, I was very intrigued because I'm like, okay, I already know all the screeners. I already know what those questions look like. I do them all the time. So that's also why I wanted someone who had a higher level of education than myself, or more experience at the very least. And so my first session was so interesting because she was asking, we just were talking for like maybe 5 or 7 minutes, and then she goes, well, you score like an 8 on the GAD. And I was like, how? You didn't even ask me the questions. But she was right, because then we started talking about it. And I'm like, I don't even know how you got that answer, but I'm not gonna disagree. so so yeah, that was very interesting. And then just like, but like this goes back to like what you were talking about with like coping mechanisms, and like I don't even realize sometimes for myself that like coping skills are good and negative, the ones that we use. And so that was just very insightful. And you're right, like when we do change just some of the smallest things in our routines, then you can revert back to some of the negative coping skills unintentionally or not even aware of them.
Yeah, absolutely. And then uh, all of those things, I mean, we talked a lot last time about addiction, right? And how those feelings and those discomforts and those incongruencies in ourselves that are human, that are just like that is just the human condition, right? We are paradoxes. We want one thing and then we don't want it, right? We think we love something and then we don't. We're very complex creatures.
Yeah.
And because of that, we have all of this struggle within us, right?
Mm.
And it is that constant struggle, and it will come out in whatever way that it can, whatever way it's allowed to come out, it will come out. And so some of those things are helpful to us. And uh, actually, even when I say that, I never really like that term, because really every coping strategy that we use, whether it's helpful to us or not, is helpful to us at the start. The first time we do it, it feels extremely helpful to us. And so, as humans, especially when we get into a place of, I don't know what to do, right? I don't know what to do. Uh, we can get to where we go, well, this worked one time, right? This worked one time, so I'm just going to go and do that again, and maybe it'll work again this time. And what I like about what you said about going to this new counselor for the first time was that, it seemed like you didn't have to do this, like, okay, what is your name? Right? How many times a week are you gonna, and it didn't feel clinical. It felt conversational,
Yeah,
right?
absolutely.
She was gleaning those things just from what you were saying about
Mhm.
your life. And I think that's huge, because uh, somebody who is trained to be able to identify those things and be able to go, I can see where some of those things are coming out for you. Like, that sounds uncomfortable, right? Like, that sounds hard. I can see where those things are coming out, all of the little, pinpoints in this where all the slime is coming out, right?
Yeah.
And when somebody can see that in us without having for us to say, okay, well, here's one, right? This is
Yeah.
challenging, right? I have this feeling, I have this thought, I have this. When somebody's able to see that and glean that from us just from interacting with us, there's really a magic in that.
Yeah. Yeah, it was very interesting. Because in the past when I've done counseling, it's always been the kind of like straightforward question and answer. And so this was very different. And yeah, that was insightful. So to
Yeah,
say the least.
yeah. And I think that can be such a barrier for so many people to going to counseling, right? Like, okay, is this gonna feel like a job interview? Like, am I gonna have to,
Right.
just answer all these questions? And is this person actually going to understand me? Or is it just gonna be, they're gonna understand my list of symptoms?
Right. Yeah.
Uh,
Yeah. So yeah, lots of big life changes, and I think that this will be very helpful for me because it's more of like the unknown. Like I'm aware of a lot of things about myself, but there are things that I also do that other people might see that I don't. And so just having that extra set of eyes or insights uh,
mhm.
to, anything that I'm not aware of, I think that's important too.
Absolutely. Yeah. We can't see the back of our head, right? We can't see. When we started this show, my hair was really, really short. And so I would straighten my hair just super, super short. And it was like very angled. It was a whole thing. And so I would do that for the podcast. And Krista would always laugh because after the show, I would show her what the back of my head looked like. And it was not done at all. It was like sticking out the back. And I was like, see? Because she'd be like, oh, your hair looks great. And I'd be like, yeah, from the front. It does.
Right.
Right?
Exactly.
I'd show her the back. It's just, And so I, I always think about that with counseling because we put our uh faith in so many mirrors around us, right? There's like the literal mirrors where we can see, okay, what does my hair look like? What do I look like today? Whatever. There's those literal mirrors, but there's also the things like relationships, right? Our relationship with our child's struggles, our relationship with our parents or siblings, our relationship at work, right? How we feel like we're doing at work, how we feel like we're doing at life, how we feel like we're doing with our friends. And those are all mirrors that we use as well to try to gauge, okay, where am I, right? Where do I fit in these places? And there are certain places of ourselves that we don't have a mirror for. Like I don't have a mirror for the back of my head. And so that is such a great point. That is where a counselor really comes in and goes like, yeah, I can see the back of your head, right? And also I can see that the back of your head is a mess, right? Whereas the front of your head is like perfect, whatever.
Yeah.
I can see that. And also I think you're still a good person, right? I still think you are a good and capable and lovable person, even though your hair looks like this in the back, right? I'm going to let you know that it does look like this in the back. But it's so that I can help you with that, right? So a counselor is the person who comes up with a comb, right? And says like, okay, I'm going to show you with this mirror that I'm holding, this is what it looks like. Now, how do you want to brush this out? How do you want to handle this situation? And I'll hold the mirror, right? And I'll hold the comb and you direct it if you want to change what your hair looks like in the back. And I think that's just so important because I think that when we think about our blind spots, it's very tempting to think about like it being painful when other people point out our
Yeah.
blind spots, and if we are talking at lunch and then we've got spinach in our teeth, right? And somebody in an unkind way says like, ugh, what is that? Okay. Um, and so I think we've all experienced having our blind spots pointed out or our vulnerabilities pointed out in unkind ways. And it really takes that trust in that counseling relationship to be able to go like, no, I want you to look at those. I want you to tell me.
Yes. Yeah.
Mhm.
Well, and kind of on the flip side of things, for like we talked about my daughter previously,
Mhm.
um, she has recently turned 18. And so what we ended up doing was actually removing her from counseling, because she's been in it for like 6 years, like
Mhm.
nonstop for 6 years.
Yeah.
And so this is kind of, we're giving her the opportunity to not to say like, oh, you can't go back, but also like try to do this on your own now.
Mhm. Mhm.
Because you've got all of the tools you could possibly be given.
Yeah.
Kind of like, I don't, outside of processing, so like, for her, it's kind of learning to be independent in her emotions and not always having somebody to fall back on, but being able to handle those independently.
Yeah.
And so, she's always got her therapist number on call if anything happens, but this is kind of an opportunity for her to kind of try to do things. Um,
Mhm.
yeah, I'm not sure what the word is for that, but yeah, more independently, I suppose.
Mhm. Absolutely. Yeah, because it can be uh it's great to have a support, right? And so I don't know if you ever do gardening, but
Mm.
when we grow beans here, we need to have those stakes in the ground, right? Those poles so that the beans can grow upward because we don't have a ton of uh space wide, but we have a lot of space up. And so when we do that, we have those stakes there, those supports there. But with certain plants, at some point, you have to take that away because they have to be able to stand up on their own.
Yeah.
And with having the support there the entire time, then the plant will grow in that direction and it will not stand up straight and develop the the strength that it needs, right, to stand
Yeah.
up straight on its own. And so using that intentionally. And I think that's really what it's about. And that's I think what you're kind of focusing on is like using that support in an intentional way and not in a default way.
Right. Yeah.
Mhm.
Yeah. Yep. I do think that there is a lot of quality, like, especially when you've been doing it for so long, that you kind of become dependent on, like, oh, it is really good. It's kind of a catch-22 because it is really good. Oh, it's always good to have that extra support, and it's always good to have someone process things with.
Mhm.
And also, being able to process those through yourself,
Mhm.
um, and become kind of an independent thinker. I just feel like that was really important for transitioning into adulthood anyway.
Mm, mhm. Yeah,
So,
it's such a big transition anyway, turning
yeah,
18 and becoming an adult legally, and there are so many societal things happening at that time, and kind of a separation from the family, and I think that's what most of us want for our children is that they be able to be an independent person, that they be
yeah,
able to be themselves and exist independently from us, even though we're still a support, we still want to be there available to them. But we want them to be able to know that they have self-efficacy, that they have autonomy, they have self-efficacy, and they are a capable person on their.
yeah, yeah, yeah. I know, like, I know there are lots of people that utilize therapy for very long periods of time, and for some that is absolutely necessary. Like for my daughter, that was necessary.
Yeah.
And then she's kind of at a point now where it's like, it is helpful, but not necessarily necessary.
Yeah.
Uh, so, I think that there's just keeping in mind too, like there is a point where maybe you've maximized kind of the benefits of it, and now you'll just kind of stay stagnant. And so, how
Sure.
do you move from stagnancy?
Yeah. Yeah. So what was that process like for her, transitioning out of counseling, especially with being in for so long?
Yeah, no, it was a grieving process for her, honestly.
Yeah.
To begin with, it was very difficult. I think to her, it kind of felt like losing a part of her, her identity, really,
Mm.
because that's most of her. I mean, no, like half of her childhood was therapy, and so how to identify as a person without that part of their life means kind of redefining it. Um, so for her, that was a little bit of a process. But now we're like 4 or 5 months removed from this. So, because we started this before she turned 18, obviously, but I think that it's better. I don't think she's. I think if I said, "Hey, you want to go see your therapist tomorrow?" She'd be, yeah, absolutely. But she's doing all right. She's doing all right.
Yeah. And I mean, part of that is the the identity piece that you described. So uh if as we go through childhood, right, especially things that encompass a large part of our childhood, that can become a part of how we identify and how we identify ourselves. And young adulthood, starting at 18 and going until like 30, 35, right? The young adulthood uh, is kind of that chance to start new and
Yeah,
to go, okay, yes, there are definitely pieces of my identity from childhood that I absolutely want to bring into adulthood, right? But I don't want to do it by default. I don't want to do it just because I'm doing it and I'm gonna keep doing it, right? I want to intentionally choose what pieces of myself still fit, because 6 years in the life of a child, a 12-year-old's needs and an 18-year-old's needs are are so vastly different. And so being able to say, no, fresh slate, right? If similar to the experience that sometimes people have when they move, right? They go, okay, fresh slate house or fresh slate apartment, right? I'm only taking with me the things that I know I want to have with me. It's not like just living in my house and going, well, this thing is here because it's been here for 10 years, right? These are the things I intentionally want to take with me. I think that is so important. I'm so glad that she's doing that work for herself.
Yeah, there's certainly been like hiccups, which were completely to be expected after transitioning out of therapy.
Mhm.
Um, and, we expected those things to happen. But the important thing is that she's learning to get through them. There is times where she's like, I just want to see my therapist. And I'm like, I know, but you also know exactly what she would tell you. So, just apply that now.
Yeah.
So
Oh,
it's a
I
learning.
bet. It is, absolutely. Yeah, that's a challenging thing. And sometimes we outgrow therapists as well. There's, as you know, there are so many evidence-based modalities, and each person kind of has the ones that resonate most with them as a counselor. And so sometimes you go to a counselor and they see you as a 12-year-old and they see who you are at 12, and they see things through their own counseling lens as well. And so sometimes a transition like that too, the next counselor that your daughter sees is going to see an 18 or 19 or 20-year-old woman in front
Right.
of them, and not a 12-year-old anymore. And it's amazing, we see it with our own children. We look at them and they're 15, but we go like, no, you look 4 to me,
Yeah.
And so the same thing happens with those long-term counseling relationships as well. It can be more challenging to have that fresh start for ourselves when we're in counseling relationship with somebody who has seen us as a
Right.
12-year-old.
Yes. Yes. And I really hadn't thought of that age and the viewpoint of a 12-year-old versus an 18-year-old, but I think you're 100% right on that. That does happen.
Mhm.
And so yeah, becoming transitioning into that adulthood, um, that is one thing that we talked about is if you just decide to go back to therapy at any point, then we would probably try with somebody new, and not because she wasn't effective or good, because she did a fantastic job.
Right.
Um, but but yeah, because how you have to try something different too.
Sure. Absolutely. Absolutely. And if trying something different and then we go, nope, don't like that, right? That's okay, because at least we know we're intentionally knowing
Yeah.
whether we like something or not, versus just knowing this is what I do, right? This is what I do because this is what I've done. So I think that that's so important. So
Yeah.
yeah, yeah, amazing. And what was that like for, I know that you said that she had some bumps along the way, which honestly is expected, like you said, and is great because
So we learn.
if it was 5 months of like, well, everything's great, right? Then we still have in our minds, well, when that thing happens though, when the shoe falls, what am I going to do? Am I going to be able to handle it? Versus, okay, things have happened, and
Right.
I've gotten through them. That knowledge, that experience is so important.
Yeah. Well, yeah, and I think right now at this stage of life, distress tolerance is a common theme, that for continuous work. Um, because as you transition into adulthood, obviously there is a lot of things that seem a little more overwhelming than when you're just, a kid. So
Yeah.
being able to experience it and grow with it, instead of struggling so hard through it, but more welcoming of that in adulthood, acceptance, because it's adulthood.
Absolutely. So what's that been like for you being parent to kids of so many different phases of life just all at one time? I've got one. And so the phase of life that we're in is the phase of life that we're in, that the household is in, right? We're a toddler family, or we're a kid family, and we're getting to be a teenager family, right? What is that like, balancing all of those different uh, phases of development in your house?
Well, that's a very interesting question. I don't really think of it. We just do it. Like we're in like autopilot. I mean, I have one, my oldest one, he lives on his own. He's in college. He's, doing his own thing. Occasionally still needs some help from me because he's 21 and sometimes they still need their parents for things. Um, and then we have like the 19-year-old who he currently lives with us, but he's also trying to transition into, his own place and things like that. Um, but he helps out around the house so much and with the little kids. So that is, I appreciate having him around. And then my daughter who's transitioning into adulthood. And then I have the two 12-year-olds. They're both my youngest one and my husband's cousin that just came with us. She's also 12. So I have the two 12-year-olds, like we call them cousin twins. And yeah, that's a very interesting dynamic. It's a good thing, I think. It makes my life a little more crazy with the scheduling, but that they're both in the same grade. They have the same, friend group, and they have their own friend group too. But there's just a lot of commonalities, and it kind of brings them closer together. So it helps that dynamic a lot. But as far as managing it all, I try to just make sure that everybody is managing at their level. Um, a 21-year-old and an 18-year-old do have slightly different needs, and an 18-year-old and a 12-year-old have very different needs. So just try to keep everybody managing at the level that's appropriate for their age.
Wonderful. Wow. And you've been through counseling as an individual, you've been through counseling as a family, you've been through it with your kiddos, and you are a counselor. So just a lot of great experiences there. And now that you're getting into, because you're at the midway point of your graduate program, and so you're starting to do more of the hands-on stuff and less of the classroom
Mhm.
stuff now, right?
Yeah.
And so after going through that program, what would you say are some changes that you might make in your work as an addictions counselor? Are there things that you feel like you'll be doing differently in that work going forward?
Well, as an addictions counselor specifically, I mean, even because I lived in Minnesota before and practiced in Minnesota, and in Minnesota, it's a little bit different in my experience. In Minnesota, it was always kind of like there's substance use and then there's mental health, and all they go together in a co-occurring program. But the addictions counselor is not addressing the mental health specifically. Um, and so, in Iowa, it looks, at least in my experience so far, it's looked a little bit different where the co-occurring is a little bit more integrated. And so being in the master's program has helped me significantly. Not that, because when you work in addictions, like they go hand in hand. I mean, the addiction and the mental health, I very rarely have a client who has just addiction and no mental health. I mean, it does happen, but not super often. Um, and and so it's been very nice to be able to do more integration of the two, um, because it's so important, I feel like, to address both at the same time. Um, but having just that expanded knowledge is kind of helpful, is super helpful actually. And um, so applying more of those, um, that other side of things with the mental health into the addictions.
What are some of those most common co-occurring diagnoses that you're seeing between mental health and substance use?
Yeah, I mean, outside of your, anxiety and depression, I do see a lot of ADHD, and I see a lot of people diagnosed with bipolar disorder. And that one can be tricky because if you're under same with ADHD, some of these diagnoses are very difficult unless there's like a pattern prior to use. Um, because those also look a lot like substance use too. Um, so I know that a lot of times those diagnoses don't they are not given until, somebody's been sober for, extended period of time to kind of differentiate the two. But I do see a lot of that ADHD, bipolar, also a lot of personality disorder. I think a lot related to trauma and a lot of childhood stuff. So.
Yeah, it's difficult in the diagnostic process to go, okay, what comes first? Is this a situation where somebody is having symptomology that is causing them pain and causing them challenges and struggles and and dysfunction within, and so they're utilizing the substances to cope with those symptoms that they're already having, or are they utilizing the substance and then having symptoms from that are either exacerbating or are acting as symptomology that might get diagnosed. That's a challenging. It's a challenge to do that, and that is really one of the only ways is to hold off on that diagnosis. And the mental health and substance abuse systems are. No, I'm interested that you say that in Iowa it feels more integrated, because I always feel like it's very separated in Iowa. So and I haven't had any experience in Minnesota, but I do feel like there's a lot of separation, and that I think makes it even more challenging to be able to help people, because we need to know, well, what are we looking at here, right? What's causing what, because it is so cyclical.
Yeah, well, and so kind of how it works in Minnesota, in my experience, I mean, maybe other people do it differently. I've worked in a handful of places in Minnesota, and they've all done it the same, where, if you come into a facility and you have substance use, or a facility for substance use, you have your substance abuse counselor, and then you have your mental health counselor. Substance abuse counselor can do co-occurring disorders, but like specific things with the mental health, if you are like your mental health counselor will handle like your suicidal thoughts, your borderline personality traits, issues with that, inner child stuff, like that will all go with your mental health counselor. And then your substance abuse counselor is more like a case manager and relapse preventionist. And so to me, it just felt more separated, where like here in Iowa, so far my experiences is that I can do the co-occurring and, address the issues that play a role into the addiction. So without doing anything super specialized. So yeah, to me, it just felt a little bit more connected here. But I mean, just in general, I think there is separation, where I feel like the mental health world and the addictions world should be far more collaborative. There's like, I can't see certain clients just because of, insurance reasons, because insurance doesn't approve, like certain insurances approve of it, certain ones don't. And so it doesn't really make sense. So, yeah.
Yeah. Are there barriers that you're seeing for people who want to get the mental health treatment or the mental health counseling, but I know you mentioned insurance, but are there other barriers kind of keeping people from that aspect?
Well, I mean, a lot of the clients I've seen, especially recently, they come in for substance use treatment, but really want to focus a lot on the mental health because it significantly impacts their ability to be have sobriety. And so, if there's a separation with be it from insurance reasons or whatever else, it's very difficult for someone to be sober and not addressing that mental health part of it. And when you have to then go see two separate people for that, then that makes it even more difficult, because now you're setting up this another thing that should be essentially addressed in one sitting.
That makes sense. The separation being a barrier, but I'm encouraged to hear that that the majority of your clients that you're seeing that are coming in for substance use or substance abuse are having interest in the mental health side, because I don't think that's always been the case. There's been so much stigma about mental health, and sometimes, there's the idea that, well, I don't need that, right? I just need help with the substance use, or I'm required to do this treatment or whatever it is. And but I agree with you. I see this shift here that's been happening the last maybe decade of, this transition where there's more acceptance of that, and there's more like, no, I want the help. Like, please give me the help. And I think that there's more hope in that, right? There isn't as much of the idea of like, that's not for me, that's not going to do anything for me. There's more hope, and there's more, I think, acceptance of being part of the mental health community, right? And or being an advocate for other people, or being an advocate for ourselves. And I'm just really encouraged by seeing that, and I'm encouraged to hear that from your perspective as well.
Yeah, and I will say, in addictions, you mentioned like basically mandated clients. I do see a lot of that. I mean, that is very common, and it's kind of a hit or miss with the motivation with mandated clients. And I think a lot of times I think that they are coming like in a pre-contemplative stage. And I guess the goal there is to move through the stages of change and kind of gain insight through exploration.
Mm.
Of different problematic areas. I mean, they might not be willing to address the substance use, but what are you? So that kind of that acceptance commitment, like what are we willing to look at then, and move through that way. That's the way I've been most successful with that. But yeah, I would say that is a very common thing to see in the addictions world, is those mandated clients that are really not super sure about problem use.
Mhm.
So yeah, that's a different dynamic of its own for sure.
Mhm. Yeah. Yeah. I mean, I like that with any kind of resistance for any reason. And there are so many reasons for a client to be resistant to counseling. Even a client who looked us up and walked in the door, right, themselves with their own idea, there's still going to be resistance. And I think, I mean, you described it, and I can definitely relate. Where as a counselor, going to a counselor, there are a lot of resistances there, right? Because when I walk into a counselor's office, I'm not just interacting with that counselor as a client. It's like my clinical brain will sometimes not stop. So I'll be like, why are you asking me that? Right? Or like, oh, that's an interesting way to phrase that. I see where you're going, but like, why did you say that like that? Right? Those kinds of things. And so each of us has our own resistance, even if we're voluntarily signing up and going ourselves. So I like that, we're able to kind of connect with that and know, like, yeah, they've got maybe more resistant behaviors than we have when we're going in, but we have resistance too, when we're going in as well.
Yeah, most definitely.
Mhm.
Yeah. So like I said, that's something I do see a lot of, is the mandated clients in pre-contemplative stage. And then, yeah, the mental health. Yeah, there's just, like you said, it's an art form. I mean, there's so many different dynamics, and I do like the resistive clients. I mean, I like when you come in willingly and we can just really get down to the nitty gritty. I
Yeah.
mean, that's always fun, but also the ones that are resistive, and watching that change is pretty amazing.
Mm.
And I mean, sometimes people can't move out of the pre-contemplative stage, and that's where you also as a counselor just kind of have to practice that acceptance as well.
Mhm.
um, you know but if you're able to help them move through that stage of change, it's pretty amazing to watch. um, and it is an art form. I'll just leave it at that.
Absolutely. And if we as counselors don't do that acceptance part, clients feel that, if we are going to a counselor and they want change more than we want change, we notice that, right? And that's going to build up our resistance to the process, and make it more difficult to flow with the process.
Yeah.
Mhm. Wonderful. Well, thank you so much for being here. This is great. And it's exciting to kind of catch up with you and hear more about where you are in your program and the things that you're doing now, and get kind of your life updates. I feel like there's always a lot going on. You're so busy and you've always got a lot going on. Uh,
Yeah.
but it's like good stuff, your capacity for multiple things happening at once is amazing to me, because I'm very like, this is my one thing, right, that I'm doing.
You know that term chaos coordinator,
But
that's
yeah,
pretty
that's
good at
hilarious.
it.
Absolutely, you're great at it. Well, thank you so much, Ashley. And if you could give one suggestion to somebody maybe on the fence about starting counseling or starting counseling again after there's been a gap, what suggestion might you give them?
Like I said earlier, I guess the first thing is if you're looking to go back to counseling, to give it a try. Start when you're in a better space rather than when you're in a crisis. So be proactive. And I would also go back to just giving it a try and allowing it, even if it doesn't, if you're not sure about it, if you're on the fence, just give it a try for 4, 5, 6 sessions before you make a determination. Because I know that a lot of times when you first start, it's like getting to know each other and it doesn't feel very therapy like. And so just giving it some time to build that relationship together. And then, coming into those things with, an open heart, being willing to learn and, with some humility, and just keeping an open mind throughout. And then being honest with your therapist about things. Because if you're not honest with yourself and you're not honest with them, and then you really can't get as much out of it as you should. So, yeah, open-mindedness, honesty, and willingness. So.
Yeah, those are great suggestions. I like the idea too that you're kind of talking about here, where sometimes it's easy to think like, oh, I'm making the decision, should I go back to counseling or not? I'm making the decision like when I decide to call or when I decide to Google it or when I decide to like make the appointment. And I really like what you're saying about too, of like, you don't have to make the decision right then, right? Like that's the decision to try. That's the decision to go. Like you can wait until session 6 or 8 to make the decision. Am I going to do counseling?
Right.
And so that takes a lot of that pressure off of those first couple of steps. As
Yeah.
yeah,
Yeah. It's a process.
it is. Absolutely, it is.
And I'm Ashley Casey, and I need a counselor.
Awesome. And I'm Julie Johnson, and I need a counselor, and so do you. Bye.
Thank you for listening to the You Need a Counselor podcast. We are so grateful that you're here. You can also find and connect with You Need a Counselor on Facebook and Instagram. If you've enjoyed today's show, please take a moment to like, review, or leave a comment, as all of these things help others to find and benefit from the podcast as well. If you're in the state of Iowa and interested in mental health counseling or behavioral health intervention services, give us